Hi guys, Dr. Blythe here with Expert Spine Care. Today we're going to do Q&A. This is the time that I kind of donate to my followers to actually answer questions that they may have. And we have a couple of people have asked some certain questions, and we're going to just get right into the heart of it. Amy Jo Chris says, look well to the spine for the cause of disease. Why the spine? Why not the heart, brain, or even blood? Well, I, with due reason, am a little bit impartial to the spine. But I would tell you though, without the brain in the central nervous system, then nothing else would actually work. The brain is the mother of all the vessels, all the heart, all the organs that we have. Additionally, the brain is, all the transmission goes down through the spine. So if we block that, then hearts, livers, kidneys, all those things are kind of impeded and they don't get the amount of information that they need to get from the brain to the organ. So if we can actually live in a very healthy spine lifestyle, then all the other organ systems do work and function well. Rosemary. Rosemary actually asked me two questions. When do you do a fusion in addition to a laminectomy or a laminectomy alone? Well, that's a great question. So there's two different things that we can do as spine surgeons. And, you know, to be honest with you, spine surgery is really not that complicated. We can treat you conservatively, which is anything that does not involve surgery. That's injections, physical therapy, anti-inflammatory medications, and then even steroid injections on top of that. Now, what we can do as spine surgeons to surgically treat your problems is we can do a decompression or a decompression infusion. And a decompression itself basically means removing the lamina. The lamina is the bone bridge over the top of the spine. When we remove the lamina, then we can actually free up the space for the spinal cord and the nerve rootlets. And by doing that, we're actually basically doing kind of like a rotor-rooter around the spinal cord. Now, sometimes when the disease is in the disc itself, that the disc is collapsed, the foramina gets stenotic, a lot of times those require fusions with laminectomies. And a fusion is I go in, I take out the disc and I replace it with plastic, metal, or even bone and rebuild that space. And that offloads the nerves that are coming out of the foramina. So great question, Rosemary. We'll go on to your second one. Why did I specialize in spine surgery instead of just other areas of orthopedics? Well, I got a little personal story to tell you. When I was 17 playing football, I was actually a college recruit. I actually had college, basically people looking there to maybe pick me up for a football team. I hit somebody so hard, I actually suffered a condition called transient quadriplegia, which basically means that I hit him so hard that I was completely paralyzed for about 4 hours. Could not move my arms, my legs, or anything like that. I always wondered what that meant, and I was told I couldn't ever play football, and so I had to kind of hang up my career in college football, even though I very much love playing football. And so I've taken a keen interest in that. Additionally, my mother suffers from pretty bad neck conditions, and she's had multiple cervical fusions. And for me, I wanted to figure out why she had to go through the stuff she did. So that's just a personal note on me. Abby Metcalf asks, what's the best way to do abdominal exercises after surgery? Well, here's the thing. Any abdominal exercise after you've been cleared by your spine surgeon is completely okay. Provided you don't have this huge long fusion going from your thoracic all the way to your lumbar spine. Basically anything's a go. The whole reason why I do spine surgery and I use the minimally invasive techniques is so that people can get back to their normal work lifestyles and their normal activities without having restrictions. I want you to be as normal as possible. So if you want to do crunches, you can do crunches. If you want to do sit-ups, you can do sit-ups. There's different things out there online, and I don't think that any person that I've ever done surgery on to this point, I would recommend continue to do the core strengthening exercises. Well, that's it, guys, with Expert Spine Care. Thank you for your questions and your interest. Stay tuned for more of these Q&A sessions. We'll probably do some live sessions in the next couple months or weeks, but thank you for your interest.